Awesome. Good morning, everybody. Thank you so much for joining the last day of our conference, Revolutionizing Health Equity. I'm Monica Lee. I'm the Senior Communications Manager here at CPEN. And as usual, I'll be going over a few housekeeping items today before we get started. Next slide, please, James. Next slide, thank you. So all of our sessions, including our plenaries, will be recorded. Recordings and slides, as well as any other materials and resources, will be available to attendees after the conference, both via our website and via email. You will be on mute. Please use the chat and the Q&A features on the right-hand side of your screen to interact, engage, ask questions. Our CPEN staff will be monitoring the chat and the Q&A to assist you with anything you might need. If you need technology help, please call 510-832-1160, extension 308. You can also post in the Ask Organizers Anything community board, and that is on the left-hand side of your main navigation. If you go to community, you can post and ask your questions there. At the end of our sessions, please scroll down and click Like Session under the video screen to complete a short evaluation. We'd love to get your feedback. Also, for any of the previous workshops you've attended, you can go back and click Like Session and still complete feedback, even if the day has passed. Check out our virtual exhibitor booths. All of our sponsors have an exhibitor booth, and they are at that booth ready to answer any of your questions and share materials. Also, that is on your left-hand navigation if you go to exhibitors. After our agenda overview, we'll move straight into the plenary. There is no need to change Zoom rooms or go anywhere. You'll stay right here for the plenary. Please do note, if you enter full screen mode, you will no longer see the chat and the Q&A. So if you would like to participate in those items, you will need to have the smaller Zoom screen so you can see those. Tweet along with us using the hashtag #VoicesForChange2021. We'd love to hear your thoughts and your insights and your takeaways of what you've learned and gleaned from all of our panels and panelists. And also, we have no breaks, so if you do need to get water, coffee, stretch, whatever you may need to do, please feel free to do those at any time. Now I'd like to introduce a short video by Dr. Robert Ross. He is the president and the CEO of the California Endowment, and he has graciously recorded a video for us to be able to share with you all. So my colleague will be sharing their screen, and we will play that video momentarily. Thank you all so much.
Hi, this is Dr. Bob Ross, President and CEO of the California Endowment. On behalf of our board and our staff at the California Endowment, we salute CPEN and all of its family and friends and colleagues for this Revolutionizing Health Equity Conference. We thank CPEN and honor their efforts and leadership in bringing health equity to the state of California in a collaborative and partnership way. And boy, is this ever the moment for revolutionizing health equity. First of all, we've all been working at this issue for many, many years and many, many decades. And the time to realize true, full, and meaningful health equity is now. Secondly, the COVID-19 pandemic has unmasked all manner of structural inequality and racial inequality and health inequality in our nation. We've seen major gaps exposed by COVID-19 in our public health systems, our healthcare delivery systems, our economic inclusion, our housing affordability. All of that has taught us about structural inequality in America. And thirdly, and maybe most importantly, we've understood what the solution is to health inequality in America. And that solution is called people power. It's the ability to raise the voices and experiences of the most vulnerable in our communities, farm workers, immigrants, frontline workers and essential workers, Black and brown communities, Asian Pacific Islander communities, immigrant communities. All of us have been vulnerable to this pandemic and vulnerable during this time in our nation. But people power can make the difference. Lifting those voices for policy change and systems change has never been more important in our nation's history. So the time is now. And the moment for you having this conversation about revolutionizing health equity is critical. We'll be listening for the important themes that come up in your conference and your convening, and we can't wait to continue to lock arms with CPEN as we try to achieve full health equity and full inclusion for all in the state of California. Thank you.
So thank you, big thank you to Dr. Ross for that welcome, for that inspiring video, and for your passionate leadership for health and racial equity for so many years. Welcome back, everyone, to the third and final day of Voices for Change, Revolutionizing Health Equity. If you missed either of the first 2 days, we'll be making recordings available. And I'm Kieran Savage-Sangwa, and I'm the Executive Director here at CPEN, which is a great honor every day. I hope that the last 2 days have inspired and uplifted each of you. A huge thank you to our absolutely stunning speakers who have brought voices from communities across the state into conversation with a shared commitment to challenging and disrupting structural racism and policies of exclusion. I also want to extend my deep gratitude to our CPEN staff team who has worked tirelessly this week and for months of preparation to bring you this event. After hearing from all of you this week, I'm hopeful about our future and I'm ready to get to work. So that's what today is all about. It's about getting to work. So before I introduce today's amazing plenary speakers, I'm going to turn it over to Mihei Jung, who's a member of our CPEN team, and she's going to run through our agenda for the day. Mihei?
Thank you, Kieran. Can folks hear me okay? Excellent. Hello, everyone. Welcome to our conference. My name is Mihei Jung. I'm the Community Advocacy Director. It's such a great honor to work with everyone and our partners every day. It's really great. I'm going to run through our agenda today. So if you're having any tech issues, you can join Technology and Event Help anytime, and that's on the Whova page. And the workshops that we're going to have today, it's really exciting. We have 3 workshops that we've coordinated for you. The first workshop is called Bridging the Gap, Collective Healing and Systems Change. And this workshop explores how you can bridge the gap between healing and systems change. The second workshop is Envisioning the Future of Public Health in California. And this workshop explores the vision of public health amid the global pandemic and a movement to defund the police. And the third workshop is Putting Consumers at the Center of Healthcare. And this panel will discuss efforts and challenges of care coordination across different systems of care. So after the workshops, we have technology office hours at 12:30, and this office hours has been happening every day from Tuesday, Wednesday, Thursday. So these are opportunities for you to learn from experts on a variety of topics. Today we have technology office hours. You can join us and ask any questions you have about technology. And this training will be led by Ash Shepard, Chief Program Officer at Nonprofit Technology Education Network. And lastly, show some love and shout outs to our chat box. Please share with us where you're joining us from. I am joining from Los Angeles. And so, share with us where you're coming from. And now, Kieran will open our final plenary of our conference, 2020 Election and Health Equity. Kieran, take it away.
Great, thanks so much, Mihei. I'm so excited for today. And I actually think this morning we're going to have some fun with this plenary, or at least what I think of as fun. We're going to hear from 3 of our sort of political experts about what's up in California and Washington, D.C., and what do we need to be thinking about. It's been 3 months since the November general election turned the tide at the federal level by putting President Joe Biden and Vice President Kamala Harris in the White House. At CPEN, we have been emboldened by the immediate actions of the Biden administration on healthcare, on immigration, the environment, and racial justice. We were also inspired by the elections of those such as Sarah McBride, the highest ranking openly transgender elected official in our history, and Cori Bush, the first Black woman elected to Congress from Missouri, who are making history and propelling change through their leadership. But we also recognize the challenges of making progress against the backdrop of a continued COVID-19 crisis, a white supremacist insurgency, and a judicial system now stacked with Trump appointees who seek to dismantle some of our most fundamental rights. In California, we were so proud to see record voter turnout in November as our state embraced a number of policies to make it easier for all of us to participate in the democratic process. We passed voter initiatives to reform criminal justice, but we also saw serious setbacks to workers' rights and a lack of investment in schools and healthcare. So what does all this mean for health equity? What does it all amount to? That's what we're about to find out from our experts. So what I'm going to do is I'm going to introduce each of them. And when I introduce them, I'm going to ask them to just say hello to make sure that we have everyone's audio. And then we will dive into our conversation. So first, we're so lucky to have with us today Alma Hernandez. She's the Executive Director for SEIU California, an organization dedicated to electing candidates and passing policies that benefit the over 700,000 members of SEIU and their families in California. SEIU represents janitors, home care workers, social workers, professors, school workers, healthcare workers, and city, county, and state workers. It's the largest labor union in the state and a powerful voice in California for working people. We also have joining us from Washington, D.C., or maybe today from North Carolina, Frederick Assassi. Frederick was selected to be Families USA's second ever executive director in 2017 because of his lifelong commitment to achieving health equity, affordable health care for all. Mr. Assassi frequently testifies in Congress and is a well-known national speaker on Medicaid, state innovation, health system transformation, and I could go on and on. And we also have with us, probably needs no introduction for most of us here in California, but I will introduce him anyway, which is Anthony Wright, who's the Executive Director of Health Access, the statewide healthcare consumer advocacy coalition. He has been leading that organization since 2002. Health Access has led state and national efforts to win consumer protections, fight budget cuts, and invest in our safety net, encourage prevention, and advance coverage expansions and comprehensive health reform. So I forgot to let each of you say hello as I introduced you. So let's just do our double check here. So Alma, do we have you with us? Okay, we'll circle back to Alma. Frederick, do we have you with us?
You do. Hello.
Hi, welcome. And Anthony, do we have you with us? Perfect, we've got Anthony. All right. So let's dive in here. Frederick, the first question is for you. So I think we all know that Joe Biden is now our president, but tell us what else has changed on the federal level, and maybe what were some of the surprises and some of the most important changes that we saw with this election when it comes to healthcare?
You bet. So, it was such a historic, really unusual election cycle. And it was really the confluence of all of those really important issues that you just raised, Karen. We had this incredible pandemic that has been, across the world and in the United States, just wreaking havoc. We also had an incredibly important moment around racial justice that has been so important and such a part of the election cycle. And the interplay between the two, the really deep inequities that we're seeing through the COVID crisis, both on the health and economic side for communities of color, have really, all of this has come together. So it was really powerful in all those ways. And then we also had the incredibly polemic politics of Donald Trump and the Republicans that supported him, who really were playing off of fear and folks' xenophobia and a real nationalism, and those things all came to bear. And what was interesting, the populism that Donald Trump represents, I think we're still digesting the election results, but in a lot of discussions we're having right now with the political operatives and the campaign heads, what we saw was really startling. First of all, what we learned was that populism is more durable than just about everything else. Donald Trump actually increased the number of people by 9 million, the number of people who voted for him after everything that we lived through the last 4 years. In addition, there's no question that the Democratic base is one of the most important factors that turned out for Joe Biden. He got more votes than anybody in the history of the country, right? But the other factor is that people of color, many of whom are in the base, were incredibly important. But in terms of Asians, Latinos, and African-American men, Donald Trump actually increased the percentage of those folks who supported him. So very confusing results. And I think as a result, it is both in the minds of all the elected officials and policymakers, and also is reflected in the margins that are so tight. Now, California is in a different place, but if you look around the country, we have a Senate that is 50-50, a House that's actually closer now to 50-50, just a few votes separate the two parties. State capitals, we had almost no swing. We actually Republicans picked up Montana gubernatorialship and New Hampshire legislature. And that sort of blue wave of Democratic governors has slowed down. So what really this election showed was that the divided government that we've been living with just really solidified. And so one of the biggest challenges we're all going to have on the federal level and in many state capitals is how do we effectively utilize this awakened consciousness, particularly around health equity, to drive important, long-lasting change in the environment of divided government. And we can talk about this later. We've done a lot of work on that question. But I want to end with a really hopeful note, which is we've done a bunch of polling and message testing. And one of the things we have found is there is a renewed and deeper understanding of the American people, of the connectedness of health. There's a new embracing of the social determinants of health. And when it comes to particularly people of color and immigrant populations, there's an understanding that our health, it all hangs together, that my health is dependent on your health and your health is dependent on my health. Those are very, very powerful new awakenings that we can leverage to really drive equity.
Thank you, Frederick. I know that's something we've been really trying to reconcile too, right? Is the really mixed results that we have in a lot of ways. And I think many of us were hoping for a much bigger shift. And just to pick up on that point, can you tell us, in previous elections, we've talked a lot about healthcare being one of the #1 issues that influenced how voters made decisions. What would you say about 2020? How big of an issue was healthcare, and maybe in what ways? Like, was it because of COVID, or was it less of an issue because people are worried about their jobs? Like, where do you think healthcare fell in the priorities that voters had?
You know, and we're about to release polling results. We just went to the field to understand this question. And we also had a roundtable with kind of the lead political operatives that were working the cycle to find out how healthcare played out. It's, again, really complicated stuff in terms of the way it's playing out. First, what we know is that dealing with the pandemic, both as a healthcare crisis and an economic crisis, was absolutely the top of almost all voters' minds. In rural America, in urban America, across the country, that was job one. So the idea of the pandemic as a health crisis and economic crisis had a lot of resonance, and that is one of the major pushes that politicians are getting right now. Two, this discussion we had about the awakening of the American consciousness to social determinants and connectedness of health, it hangs in a lot of different ways. But one of the things we've seen, for example, is a real understanding of the precariousness of an employer-sponsored healthcare system. That as we had, 15 million plus Americans losing their jobs, they lost their employer-sponsored health insurance, and a renewed commitment from a lot, not all, but from a lot of politicians and policymakers in cycle to say, we've got to figure out a way to make sure that no matter what your circumstances, either through Medicaid, health insurance subsidies, or your employer, your coverage is there and it's affordable. That's the second thing. The third thing I would say is the #1 issue across the country after you deal with the pandemic and amongst all voters, Republicans and Democrats, it's cut in different ways, but fundamentally it's the same issue, which is affordability. Affordability is still the top of mind for almost all Americans when it comes to healthcare, and it's almost always in their top 1, 2, or 3, often the #2 thing after COVID.
Thank you. Thank you for sort of helping us understand that, Frederick. Anthony, do we have you with us now? Okay, that's okay. We have lots of questions for Frederick, and then we'll circle back with Anthony. So Frederick, when you think about what's on the agenda for the Biden administration, what do you think is top of mind for them? I know we're getting fairly well into the first 100 days here, but when we think about healthcare, what's sort of top of mind for healthcare for the Biden administration in terms of the administrative actions that they have the ability to take, and particularly what's top of mind when it comes to health equity?
You bet. And what I want to say is I think the wonderful staff at Families, and let me just say, Karen, we love CPEN. We love the work you guys are doing. It has been such a joy to work together with you guys. You're such a model around the country, for the whole country, of how you can bring together the right political power and smarts to really drive equity. So, but that's a side note. So to your question, one of the things that we see is that and in the office, I think it's taking a lot of time for this to sink in. Good government is back. Good government is back. The folks who are going into the administration, the people who are getting put into political positions, these are smart, talented people who really are trying to get the government to work on behalf of all families. And so, we see this in 3 different ways right now. One, an incredibly aggressive, organized approach to the COVID pandemic. Science is leading, it's nationally coordinated. They're using the Defense Authorization Act to make sure we can get vaccine produced, et cetera, right? So the COVID response, both legislatively and administratively, is job one for the Biden team. They're very clear about this, and that you can see that from their agenda and what they're going after. And they're thinking about it in a very holistic way. They're thinking about it both as an economic and health crisis. They're thinking about it as they're trying to improve health insurance coverage. They're trying to improve the ways in which communities can come together, the use of science to drive policies, all those things. The second thing that we see coming out of the Biden administration is a real focus on the economic toll of the pandemic and a real push towards a large infrastructure package and anything that can really help spur the economy. So that's 2, and that's a lot of the really important policies around, for example, the earned income tax credit, help for parents with children for daycare, getting schools open, it goes on and on, but that's a really big focus for them. And then the third thing that is a very big priority for them is racial justice. I think the little bit that I've interacted directly with President Biden and I've interacted with his leadership quite a lot. These are people who are not confused. They understand systemic racism. They understand that this country, the deck is stacked against people in this country. It is not fair. And they're extremely committed to making sure that the voices of all the people over the last year that have been crying out because of the death of George Floyd, because of the deaths related to COVID, that they are going to be heard and that real change is going to happen. So I think we're expecting a really aggressive, both administrative and legislative push on racial justice. And the last thing I'll say, there's a lot more to say, so we can dive into any of that, is there's so many proactive things that they're working on administratively that don't need legislative action. Medicaid reform, rolling back work requirements. We've already seen the executive order around public charge. They are really committed to returning Medicaid to be a program that is working to serve the interest of the low-income and vulnerable populations in this country and not putting up barriers. And that's another really big thing.
And Frederick, a question, kind of a follow-up question from the chat, which is, do you think the transgender, non-binary, and intersex population will be included in the health equity efforts by the Biden administration?
Well, I can tell you, I'm a gay American and lived through the gay rights struggle, which was a precursor to the really beautiful movement we're having around non-binary and other queer identity issues. And one of the things I always love to say on this question is, remember who actually got us gay marriage. It was actually Vice President Biden who slipped up and had thought that Obama had already made an announcement about gay marriage. I know a lot of his leadership, many of them are LGBTQ. This is a man who lives his values. He really believes in it. He's already appointed, we have an Assistant Secretary of Health who is transgendered. I worked with her when I was at the National Government Association in Pennsylvania. She's brilliant, and hardworking and fearless and fierce. And I'm so excited to see her in a leadership position nationally. I think that we are going to see incredible embracing by the Biden administration of those issues. And it brings me tremendous joy, both professionally and personally, as a gay American.
And that's really exciting to hear. I'll say, as those of us in the LGBT community, I think one of the things that's been really scary is watching the Supreme Court and what's happened there and sort of the challenges to our rights there. So it's really, I think, comforting to hear that we do have a president who's really going to stick up for us. So that's great. Thank you, Frederick. It seems like we have Alma. Perfect. Welcome, Alma.
Oh, good. Because James was like, make sure you're good. I'm like, I'm trying, but I don't want to interrupt. Okay, I'm good. Thank you. James, we're good.
We're so glad to have you with us. Alma, and the question for you kind of, let's bring California. I know we have everyone in this meeting who's from California, so let's bring California into this conversation. I know we continue to have a Democratic supermajority in both houses in California, but the ballot propositions were kind of mixed results, right? So can you tell us a little bit more about what we saw in California in the November election?
Absolutely. Hi, good morning. And I think part of the technical issues, at least for me, is I've got kids on Zoom as well. And so all the bandwidth this is like the prime time for school Zooming. And so we're competing with all the districts on the technology. But thank you, James, for taking good care of us. I think what's happened in California is actually very similar and follows what Frederick was saying with a little distinctions. There was definitely a Trump effect. Even in California, did see people of color vote for Trump at a higher rate than they did in the first election. And so that is something that it's not only the populism thing that we think fed it. There's still research, as Frederick has mentioned, but a lot of the conspiracy theories were targeted towards communities of color and were effective even in California in some of those spaces. COVID was the topic for California in the background always. And so it was, we went from a midterm election in 2018 where healthcare really drove a lot of the conversation to an election cycle, which was brand new to everybody, and COVID was at the forefront. But what Frederick talked about was also very obvious in California with our ballot measures. 15% of voters that voted for Biden voted no on Prop 15. And so that is something that we must continue to look at and research. And the expanded voting has been great and is what we've been working for in California for decades. But it's clear to us that we need to do a lot more research in who they are, how they want to vote, and where exactly they are on the ideological scale as well. There's just a lot there that was unknown and will be unknown, we think, for another 2 cycles. And the last thing I think that we did see even in California, actually 2 things and talk a little bit about the polling, is people of color did turn out. We turned out in numbers, but our side, the progressives in California in particular, were banking on potentially, because of California and the presidential, a depressed Trump turnout in California because of where we are on the calendar and the day of time. And that Trump depression did not happen. Trump voters in California came out at equal numbers as voters of color and our base voters. And so that is, for us, something that I think as we look forward, we can't ever underestimate that the energy in the Republican base. Us having an inability to do field really had an impact on our ability to move our base voters and talk to them in the way that we know how to talk to them. And CPEN is a huge piece of that work with us. And that was a disadvantage. And in some of the races where it was really, really close, it had an impact on our ability to win. And the last thing around, there's a lot of talk around how did we get the polling wrong, and what, polling was showing one thing and the election day showed another. There is an answer rate in the polling universe right now that is declining significantly. We went from completing 1 in 5 calls in California to completing 1 in 100. And who are those folks that are not answering and giving us data? It's a lot of times either the right, the real, rabid right folks, but a lot of them are our folks as well that are just newer to the political environment, have appropriate levels of distrust around elections, and won't answer and won't divulge any of the information. And so I think that all of those, it's not one particular thing for California. All of it, as Frederick was mentioning, everything that was happening nationally had an impact on how California voted, and California was pretty aligned with what happened in the rest of the country, in that we had mixed results. We had some wins, but we were more hopeful that we were going to make some bold structural changes, that the opportunity, the electorate just didn't go there.
Yeah, thank you, Alma. Thank you for sort of walking us through that. And Anthony, when you think about how California is sort of positioned now, you know, we have a very strong link, right, to the federal administration. We have our very own as the first female vice president, which is very exciting. You know, how do you see California influencing the national debate? Obviously, we understand the national debate influences us, but how do you see California influencing the national debate?
Yeah, thank you. And thank you for having me and for just the great leadership of CPEN over many, many years on all these issues. We are so proud, Health Access is so proud to have CPEN as a core partner of ours in all these fights. And I think I think the three things that I try to answer this question is, I think California can and should be an example for the federal government in a bunch of ways. I think we can provide specific leadership on national initiatives, as well as continuing to move forward. And then third, I think we have a really important role as the leaders of the field to try to move this agenda forward going forward. So just to break that down, you know, California is an example, and sometimes we're an example in both the good and the bad ways. You know, as much as we have Nancy Pelosi as one of our leaders, we also have Kevin McCarthy and all that he's done to enable some of the issues that we've been seeing, you know, just this week and, you know, with the impeachment proceedings. You know, we have but I think the work that CPEN, Health Access, and many of the folks that I see, you know, in the audience here have been doing to try to sort of move the ball forward on healthcare, that's actually really, and Frederick can confirm this or not, in some ways the blueprint of what the federal government is planning to do. So, for example, when we talk about affordability, we here in California pioneered the notion of let's try to increase the subsidies in exchanges like Covered California so that people can afford coverage and get themselves coverage, which is so much more important now that so many people have lost not just their jobs and their income, but their employer-based coverage with them and facing the sticker shock of having to buy coverage as an individual. And so what the COVID relief package as proposed does the remarkable thing of saying nobody has to spend more than 8.5% of their income on coverage. If we could create that as a government guarantee, that not only would help to provide real relief to people who are struggling right now as part of this relief, but set a standard that I think we can build upon going forward. And also, just to be clear, this is on a sliding scale, so it actually would reduce premiums for people at the lower incomes significantly, helping affordability for both low and moderate income people. We also here in California have taken major steps to include all Californians, regardless of immigration status, expanding our Medi-Cal program to children and young adults. And you know, we have an active effort to try to do the rest of the Medi-Cal population, but especially seniors who are so particularly vulnerable in this moment of COVID-19. And so I think that we can, I don't know if the federal government is going to push that far, but I think that there is some movement to try to open up Medi-Cal to cover populations that otherwise wouldn't, that, you know, even some certain legal immigrant categories, and that would create some room for us to go further as well. But so I think that we need to continue to do the work, our health equity work, the great work at holding the managed care plans accountable in both Covered California through Attachment 7 and 14 and in the Medi-Cal program with procurement, holding them accountable. That's stuff that I think we can help have some federal backup to, and especially now that we have a new HHS secretary, hopefully to be confirmed soon, Javier Becerra, who knows these issues firsthand from his work from representing Los Angeles and some of the key areas there, from his growing up in Sacramento, and also, frankly, confronting the industry in a real way, which we were happy to work with him all together, you know, when he was Attorney General, whether it's on the high price of healthcare, the consolidation of healthcare, which exacerbates both issues of affordability and of equity. I think that, again, we can use our relationships with Javier Becerra, with Nancy Pelosi, with Kamala Harris to advance health equity at another level, both for nationwide change, but also for California specific things, including potential waivers and where we can push the envelope. The final thing I just want to say about what California's role could be is on the field. We have, we have 2 senators, but we got 53 members of Congress. We have the majority in the House, 1/5 of the majority in the House is in California. So if Speaker Pelosi wants to pass something and she can only lose 4 votes or things cannot pass through the House, then we have an obligation to make sure that we don't have any people, that all of our delegation that's willing to be there votes for that, because frankly, there's a lot of other states where there might be 1 person lost in Ohio, 1 person lost in Pennsylvania, and so we need all of the California folks to be there. So we need that field. And then finally, we have we have 11 members of the Republican Party who in our state, and we need to hold them accountable for what their votes are going to be. Many of them showed their colors, and in fact their radicalism, when they voted to repeal the Affordable Care Act. 2 members actually lost their seats because of that vote, but then got back in this cycle with Congressman Issa and Congressman Valadao. And I think we need to hold them accountable for the extremism that they've now shown in other areas as well. So I think we have a lot of an important role to play in California to advance the national conversation on health reform, health justice, and health equity.
Yeah, thank you, Anthony. And yeah, it's been really concerning to see some of our Republican members who represent districts that have a huge Medi-Cal enrollment, voting to take people's coverage away as well. So thank you for sort of laying all that out for us. Alma, what about you? When you think about California and where we are, what's sort of top of mind in terms of health equity? I mean, we have this Healthy California for All, I think, commission, but at the same time, we're really struggling to do sort of basic things like distribute the COVID vaccine. So where do you see health equity sort of in the priorities for Governor Newsom and the legislature over the next year? And what do you think we might see advancing?
I think what we're seeing right now is a lot of talk around equity, and we're witnessing government's inability to understand what governing through an equity lens is and should look like. And to be fair, because it's really never been done. And, it's always hard to go after Anthony because he kind of laid out our road plan for us, the one that we all work together jointly. But I think the one thing that I'll double down on is California has a role to play on challenging the structural inequities in the healthcare system as a model for the rest of the country. And that's difficult, as we've experienced. Anytime you challenge the status quo or you take on the status quo, it fights to maintain what we know instead of breaking through to where we could be. In California, given the blue state that we are and the role we play in the national politics and the big voice we have in the congressional representation, it really is an opportunity for us to talk about and start to model some of what governing with an equity lens would look like. Because what we're experiencing is a lot of well-intentioned talk around it with very few examples of what it means to actually govern through that. And the vaccine rollout is one of the examples, right? There is data that drives towards a 65+ model because they're the ones that are the most vulnerable and the highest death rate. But when you model into that, when you go into that space, you're also looking at a 65-70% white population. And so there's a balance that we must strike around. That is where the data is driving, but there's an equity lens that we need to put. And how do we get to the vaccines delivered in an equitable way without jeopardizing that is where the communities are most vulnerable. And so it really is dependent on us to continue to push government to really try to govern with that equity perspective and what that would look like, and to us, right? Because it's something that we've actually also never had an opportunity to actually see come to fruition. And so we're in this stage right now where we're all learning as we go. And you know, we believe that California is primed to lead on what does taking away those structural inequities in our system, not only in healthcare, but across the way we govern in California, because it's a national conversation, but there are no models, or there are very few models to be able to look at to implement nationally.
Yeah, and Anthony, when you think about what California might accomplish this year, next year, in terms of health and health equity, what's top of mind for you? Because I'll say some of us were very surprised not to see an expansion of Medi-Cal for undocumented seniors in the budget, as has been discussed, right, by this governor. And so sort of wondering, you know, where does that leave us? And what do we expect to see from the administration and from the legislature over the next year or two?
Well, I continue to be hopeful, or I choose to be hopeful about trying to include that in this year's budget. It was not in the May budget, but you know, since then we've gotten additional budget news that that we're in a better position than where we were in January fiscally. The fact of our inequality is not good for lots of reasons. But given that we have a progressive income tax, it has helped our bottom line, and we don't see that inequality going away anytime soon. So we think that at least some part of that is sustainable and should be funding resolutions to that inequality, including the explicit exclusion of the most vulnerable population in the middle of this pandemic. I would also say that as the federal government does extend help to us, and again, in that House package that is possibly being proposed, there's help on, you know, post-pregnancy coverage, on other things that, including things that California already does, which might give us some leeway to then do some innovative things going forward. And then finally, I would just say that the urgency of the time requires that we take this step. And so, you know, we're very much, you know, with our friends at the California Immigrant Policy Center and, you know, the immigrant rights community and many of the folks here, I think we're going foursquare to make sure that we take another step on the goal of health for all, and, you know, starting with seniors, but we want to get to the goal. And I think that's right. I do think, you know, on the broader vision, I think if the federal government does take a step, we want to, whatever the federal standard is for affordability is, we recognize that California is a high cost of living state. And so we're going to have to do better than whatever the federal standard is. But we very much appreciate that any effort to make that federal standard much better, because just let's face it, the federal government has just another scale of resources and ability to help than what the state can do. And so we really have to be good partners with our friends at Families USA and other national groups to push that forward. And then, you know, I do sit on the Healthy California for All Commission. I am very excited about the prospect of, you know, trying to figure out what is the path to get to the truly universal, truly integrated, unified system that we want. That this vaccine rollout would be so much easier if we had a unified healthcare system rather than the patchwork of our fragmented healthcare system that, you know, we rely on now for flu shots. And what we're seeing is that not only is this whole vaccine distribution a whole other area of different of complexity and urgency and magnitude, and just in terms of numbers, and that it wasn't really equipped for it. But frankly, our existing system doesn't do particularly well with flu shots to begin with. Like only like less than half of Californians get a flu shot every year. How do we use this moment to actually build our infrastructure, our public health infrastructure, our health delivery infrastructure, so we can actually do the preventative care like broad vaccinations, like other forms of preventive care. So, you know, I think I am hopeful. I choose to be hopeful that we can take the efforts and take this moment of crisis into one of opportunity on this. And I mean, the final step on this is also holding the industry accountable for these goals, whether it is on vaccinations, whether it is on health equity and health disparities. And that means using the contracting ability of, you know, our public purchasers like Medi-Cal Covered California, but also creating an exciting proposal in the governor's budget an Office of Healthcare Affordability that would look over the entire industry, set cost-based targets for industry and by region, and really provide some system approach to this. We want a healthcare system where the providers have the incentives, not just to get bigger, but to be better. And I think that's the goal of that office, and where I think we can take really important steps this year here in California.
Yeah, that's exciting to hear. We're right there with health access, so we're excited about the possibilities. And thinking more about COVID, one of the things that we've thought a lot about is public health, and sort of one of those things we put out of our mind a little bit for a long time, and now we have a pandemic, and we realize how deeply necessary the public health work is, but also how underfunded it has been over the last decade. So one question I have for you, Frederick, is what role do you see the federal government playing in this question about public health infrastructure and where we go from here? Like, do you think this is a focus in addition to healthcare delivery? Do you think public health is a focus of the Biden administration? And do you think California and other states can expect any investment in terms of public health, further investment from Congress? And you're on mute, Frederick. It wouldn't be a virtual event without that comment at some point.
That's right. We're gonna get T-shirts made at families just say 2020, you're on mute. Yeah. It's been the whole year. Well, I love this public health question. Right before I jump into it, I just wanted to echo. I just want to really applaud Anthony for this work on value. It's so important. At Families, we really truly believe, not just in California, but across the country, until we really start to attack these terrible industry abuses that are just radically increasing, for example, prescription drug pricing, hospital pricing year over year, until we really rein that stuff in, we will not get to a just system of healthcare. It is, in my opinion, the greatest threat we have to a just system of healthcare. It's actually not the ambivalence of lawmakers. It's the massive waste that is being generated by the healthcare sector. And so I think it's the future. I think Anthony's put his finger right on it, and they're doing incredible work. So I cannot wait to try to take all of that success from Anthony and use it as a national model across the country. So go, go, go. So this question of public health, it's such an important question. And I actually cut my teeth early on in public health. I did a lot of work when I was with the governors on public health issues and states. And let me give you three different perspectives on this. The first is, as you said, there's been a complete awakening to the starvation of the public health system in this country over the last 20 years and the lack of real investment. I think that we are definitely awoken to that. And it is likely that we're going to be seeing some big investments from the administration to try to really pump more oxygen and blood into the system and revitalize it. The second thing I would say is, the main problem when it comes to trying to have a robust integrated public health infrastructure in this country is public health infrastructure is built on a model of meeting community need, and it's appropriated funding that just flows into throughout the whole system. But the vast majority of dollars in healthcare are flowing through an insurance-based program, either Medicaid or private coverage or Medicare, and it's generated through payments in a fee-for-service system. And that divide, not just literally about how the money flows, but the culture behind it, is really foundationally one of the reasons why it's so hard to see a well-integrated public health system in this country. And so one of the things I think it's important to say is a lot of the reforms that California, other states are really pushing on are about reorienting the system and really changing the financial incentives so that, and I love to say this every time I speak at a hospital conference or a medical conference, I say this, we want to make it the responsibility of the system to achieve health, not units of healthcare. And every hospital CEO, I look them in the eyes and I say, listen, what the American people want from you is to be healthy. They don't want the world's best MRI. And somewhere along the way, everyone's gotten really confused, right? And so I think that there's really important value efforts afoot and have been for about 15 years now to change the financial incentives, change the way payments flow that will allow for a much greater integration between the public health culture and system and the traditional fee-for-service healthcare system that we have. And the last dimension I was going to say is, you can't really talk about, when you get to public health, you really start getting very deeply into the social determinants. And so the other elements of that, behavioral health integration, social services, economic vitality, all of those things end up coming to bear, right? And when we get this right, all of those things will be integrated together.
Thanks, Frederick. And Alma, on this question of public health, you know, you represent public health nurses and others who are doing this work and really trying to do this work well with very limited resources. So what are you asking for from the state this year in terms of public health, and where do you see public health going?
It's always about more money. That Anthony, we call ourselves sometimes the Mo Money Coalition. But joking aside, the need for consistent, stable, adequate funding to the public healthcare system is critically needed. COVID exposed, and Anthony talked a little bit about why, you know, even in not a pandemic, we just don't have the infrastructure to set up the vaccine rollout that can, you know, just put a vaccine in and get out to folks. And a lot of that is because we're not adequately funded. Now there's a moment in time that we are where we are in the legislature right now, and where is government in California, right? We have a federal government that's going to be providing relief to states in some way, shape, or form. The amount to be determined, how it gets to get spent is determined. But what California is going to experience is 1 or 2 years where we will try to fool ourselves into thinking we're flush with cash, when in reality, catastrophe is still right around the corner. And our communities know all too well that when a catastrophe hits, we're the ones that get cut first. Public health gets cut first. It's the members that I represent that are always on the chopping block, be in home health care or our public healthcare nurses, public hospitals. And so for us is trying to recognize the moment that we're in for the next year or two, understanding that we will, at least for the time being, have some resources, but that around the corner is still the cliff. It's still the huge need to adequately invest in the safety net. And so for us is, how do we keep the conversation at the forefront of elected officials, and how do we make them understand that the needs of their constituents aren't going away in this next 2 years, that when actually the impact of the pandemic is felt, it will be mostly people of color, workers in low-wage jobs that are going to continue to bear the brunt of that. And so it's going to, I think for the next few years, that's in the next 1 or 2 years, that's going to be our challenge, is how do we maintain a focus on the reality that crisis is still around the corner. And we do have to just understand and accept that that we are getting a short-term bailout, most likely, right? But that does not give any elected official a pass to take on the structural inequities and how skewed our economy is. Those are still conversations that, again, California can lead for a model for the rest of the country.
Yeah, absolutely agree. Thank you for that, Alma. I want to remind the audience, if you have questions for any of our experts here, please drop those in the chat and we'll try to get them answered in the last few minutes here. And I want to ask each of our panelists to answer a question that we have for all of you, which is, what do we as advocates, as the folks here today, what do we need to be thinking about as we prepare for the next election? Where should we be focused? And I know Alma talked a little bit about, you know, some sort of populations we should be focused on where we didn't see the turnout we wanted to see, or where we didn't sort of see the alignment with progressive issues that we would hope to see. So how do we now start to prepare ourselves, start to organize, start to mobilize so that we continue to make the progress that we want to see? What should all of us here be thinking about, and what should we be doing? So maybe, Anthony, I'll throw it to you first.
So one thing I just want to say is, I mean, on the elections is a couple of things. You know, on the federal fight, because I think that's where some of our biggest gains could be won. And again, these, as I mentioned, very small margins in the House, and so we have a really important role to play in the House. You know, to sort of buck up some of our members who might be more skittish about some of the more far-reaching proposals that we like. And this also includes people who we consider friends, people. But I think we want to just make sure that we have the strongest possible proposals passing to get to a signature by our new president. We want to be able to use, make sure that they get to the point where Vice President Harris can break a tie in the Senate. So that's really important. I think also on accountability, I would just come back to the members who may not vote for us, including the 11 members of the minority party. And, I would say some of us have been disturbed just as believers in democracy at some of their votes recently on certifying results and impeachment and other types of issues. But let's remember that that 9 of them voted to repeal the Affordable Care Act. And, not to pick on one, but I will just say, David Valadeo's district in the Central Valley, he represents 800,000 people. 400,000 of them are on Medi-Cal coverage. Half of his constituency in the Central Valley literally depends on Medi-Cal coverage, and he voted to strip coverage from many of them and cut funding for all of them. And so I think that there needs to be some additional accountability. And the thing I would also say is that some of these members won in very close, 4 of them won in very close elections. One, Mike Garcia in Northern Los Angeles by literally 300 votes, but all of them are potentially in swing seats because we don't know what redistricting is going to look like. All their seats are going to be redrawn. And so they do not know exactly the boundaries of their districts. And Alma can talk more about this, but that means that that they should, even somebody who was in a safe seat might be looking over their shoulder a little bit and maybe wanting to be more responsive to all members of their community and not just their traditional base in a world where the boundary might be extended 3 neighborhoods over that includes a lot more communities of color. So I think that's a role that we can play, this community can play, to try to build momentum for these goals.
Yeah, and so Alma, kind of the same question. What do you think? What should we be thinking about and what should we be doing to prepare for the next election?
So for us, it's always about building power in our communities on the ground to hold the elected officials accountable, and redistricting will play an impact, and it could rub both ways, right? But here's what we do know is that areas in the Central Valley are continuing to build power for themselves. And so how do we help and how do we create and support the infrastructures that folks in the Central Valley are building to take on some of these members of Congress? And I will agree with Anthony that in the next 2 years, it's going to be California's biggest role is how do we push the congressional members on the Republican side to vote their district. And that really is by continuing to mobilize the base, continuing to create infrastructures in these areas where we don't traditionally have power, but even in areas like Los Angeles, where we have, where we have the power in numbers, we aren't turning out in the same ways like the Bay Area. So there's still a lot, even in our base areas where we have the power and the numbers, we still have a lot of work to do around making sure that our folks are turning out and that they're energized and activated to build power for themselves and continue to do that. And the Inland Empire is the other place where we'll need to continue to focus our work, because that is also that's the communities where they're starting to get their infrastructure. They're beginning, it's not beginning, but they're building upon the infrastructure that we have now to try to ensure that voices that are traditionally not at the table are heard. And that is what politicians respond to. Politicians respond to people or money. And, we've been trying to get ourselves where we have the money to be able to compete, but the reality is that they will always have the ability to write one check from their profits, one big check, and wipe out in terms of money everything that we have raised. But where they can't do that is building the people power and building the base. And that is where we need to continue to focus, and where, you know, all of our coalitions and our partnerships with all of the folks on this call or Zoom have been doing and continuing to build those infrastructures and support them is critical as we're moving into 2022 and 24. And then I'll just also say this, that there's a lot of, I think, anticipation for us around what does the COVID impact actually mean in the electorate. And although we don't know, we've never experienced something like this in our lifetime. The last time was 100 years ago. And so we're not sure that voters are going to even be recalibrated by the midterm elections. We think that we may have to, in order to adequately understand how voters reacted and where they actually landed around the pandemic and the impact that it had on their lives, it may take a midterm election for us to be able to better understand them. And I know that sometimes is hard for us to hear, because our job is to push and continue to push legislators to govern more progressively. But sometimes it is wise for us to take a pause and understand better the impact of what is happening around us in voter land, to be able to move forward, given that we continue to be at a disadvantage, at least on the money side.
Yeah, thank you, Alma. I really like what they can't take away from us is our people power. I love that. And Frederick, I think you sort of get the last word on this question, which is what should we be doing? And if you can also answer a question we got from the audience, very related, which was, I love the term awakened consciousness that you used in the beginning. How can we keep this consciousness awake in the coming years?
Excellent. Okay. All right. So I'll take both questions, and I'll keep it pretty brief because I know we're getting close to time here. First thing is, there's three things on this question of the next elections. The first thing I would say is understand how important it's going to be on the minds of all the elected officials. As you all know, the midterms for a party in control are usually a very bad part of the cycle. So there's going to be a ton of concern, both in the White House, in the federal administration, and in Congress. There's going to be a lot of focus on those midterms, and it's going to drive a lot of decision making. And so one of the things I want to say here is, that earlier discussion we had about this split electorate and the ways in which we really have no clear mandate that we can leverage to create change. What's really important here is that we think about no longer talking just to ourselves as progressives, but really thinking about how we build narratives that reach across the political divide and bring folks together. We have a whole messaging guide built around this. We did this with Dr. Drew Weston, a leading expert in messaging. And it really, the main thrust of it is to remember that people's political decisions are motivated by values and not by policy. So start with our values, focus on our values, and things like equity, things like coverage, things like value actually resonate. We've got messages in this messaging guide, and we welcome anybody here to reach out and get a copy. There's talking points and op-eds, and there's rejoinders all in there that polled above 60, in many cases 70% amongst both hardcore Republicans, hardcore Democrats, and people in the middle. So I just say, in terms of the next 2 years trying to make progress, let's really focus, speak from our values, and bridge the political divide, because it's the only way we're going to get past the hesitancy and the nervousness of elected officials to the midterms. Two, really important, I think, just off of this deep dive with the political operatives, one of the things they really stressed was that we have to do a better job of creating a contrast, making sure that elected officials who are not showing up for families can be held accountable. And so I think it's incumbent on all of us to really think about how are we building a very strong contrast when somebody is operating against the interest of families, when they're opposing coverage, equity, or value. We have a very bright line way of creating a contrast that will allow them to be held accountable during the cycle, and not just show up and say, yeah, I believe in that too, right? And alongside that, what I wanted to say was, I think the next 2 years are going to be filled with a lot of really wonderful advancements. So part of that contrast is showing all the ways in which the Democrats, President Biden, people who are pro-healthcare are delivering, right? So let's remember to highlight all the progress and then hold people who are trying to stop the progress accountable. And then the last thing is the final point is, as we get close to the cycle, one of the things we work really hard on at Families USA is making sure that all of our state leaders across the country are working healthcare into the cycle. Make sure you're showing up at the town halls. Make sure you're asking the questions and putting the politicians on the spot, because let me tell you what, when they say, I am for Medicare for all, or I am for equity in healthcare, right? We take that promise and we go back to them with it. So make them make commitments in the cycle that we can then leverage now, post-cycle. Okay, and then the last question, which was the awakened consciousness. You know, it's such a great question. And I think that there's a lot of lessons that we've learned throughout the history of this country around civil rights and social justice about how do we keep the consciousness awoken. And it's a hard thing to do. The crisis creates an opportunity, but if we don't put a lot of intention behind making sure we don't slip back into the sort of the calcified, racist, and conservatism that was here before we went through this pandemic. The way we get there is, I will say, I think one of the most important lessons that I learned in my life is that the lesson of Harvey Milk, the lesson of the gay rights movement of the 70s and 80s, which is come out, right? And what coming out is really about is have the conversation, show up with your neighbor. You know, think about what it was like for a gay man or woman in the 70s and 60s when they were basically considered pedophiles, right? In the public opinion, to say, I am not that, but I am gay, right? We as healthcare advocates, as people who believe in health equity, who believe in the notion that healthcare is foundational to all people in this country and should be available to all, we have to show up and talk to people. We need to come out and not just speak to other progressives. We need to have the conversations with our neighbors who might have a Trump sign in their yard. We have to just keep, you know, that is how we're going to win this. We got to keep going. We cannot let the other side create the sense of other and then let us fall into our camps. We have to push right past that and come out as healthcare advocates.
I love that. Come out as healthcare advocates. And we had our director of the Department of Healthcare Services here yesterday, Will Lightbourne, and he said, don't let equity be a fad. And I really love that.
Right.
So I want to give a huge, huge thank you to our three panelists, to Alma, to Anthony, and to Frederick for being so generous with your insights, your wisdom, and everything that you bring. And really also thank you for your deep commitment and your hard work every day for all of us and for our communities. So this is your big virtual applause, and thank you. And we look forward to continuing the partnership as we move forward.
Thank you, California. We love you.
I'm going to turn it over to Monica Lee on our team, who's going to give folks instructions for the workshops and for troubleshooting any technology issues you might be having. So Monica, over to you.
Thank you so much, Kieran, and thank you all again for joining the plenary of our final day. We do apologize. We are working very closely with HUVA to understand what technical difficulties you all are experiencing. Again, as usual, we'll move to our breakout sessions. So there are two options. You can use the main navigation on your left-hand screen to move to agenda and pick one of the three workshops that my colleague Mihei read earlier, as usual, or my colleagues will be dropping into the chat the direct Zoom links and the password, so you can circumvent HUVA and join straight through Zoom if you are experiencing glitchiness and cutting in and out or not being able to see speakers. So please keep a lookout for those Zoom links from us. And also we have our technical office hours with Ash Shepard from N10. So please do join those after you attend the breakout session. And please don't forget to fill out a survey or a quick evaluation after each event you attend so that we can hear your feedback and hear from you. So staff will be on hand in this room, but again, you are moving to the breakout of your choosing as you did the previous 2 days, and staff will be on hand to help you and answer any questions. Thank you all so much.